put a one in the comments, maybe, if you can see it. Can you see my screen? Let me know. Put it in the chat if you can see it, and then yeah, we can get started. Okay, fantastic. Thank you, Desiree. Thank you very much. So, so today we're going to be learning about how we can understand stroke care. So, but just a bit about me quickly. I am, what do you call it? I have an extensive background within health and social care. I've studied up to level 3. I've also been a health and social care teaching assistant as well. I've also taught health and social care too, all the way up until level 6 and level 7 as well. So yeah, and I've also got like real life experience as well around health and social care. So with that being said, I'm going to start with the actual slides. So yeah, like I said, we're going to be understanding stroke care today. And what we're going to be learning about today is the causes and effects of CVA. So CVA is another word for a stroke. So what CVA stands for is CVA stands for CVA stands for it's a cerebrovascular accident. So in English terms, that's a stroke, isn't it? And what that is basically it's an emergency, and it happens when the blood flow to your brain stops, and like all of the brain cells cannot get the oxygen that it needs to survive on a daily basis. And if they don't get treatment there and then, they may even have brain damage, long-term disability, or the worst thing is death. Next thing we'll do is we will look at some of the common risk factors of CVA. And then lastly, we will examine the treatment and the support available for, first of all, the individual itself, and then the actual, support for the individual themselves. So what are strokes? How many strokes? How many types are there? So as we can see there are 3 different types of strokes. So you've got the ischemic stroke, you've got the hemorrhagic strokes, and the mini strokes as well. So the first one, ischemic stroke, this is what happens when the blood clot, it blocks the flow of blood, and the oxygen doesn't really get through to the brain itself. Now, if you look at the hemorrhagic stroke, that happens when a blood vessel inside. That's what happens when a blood vessel inside the skull itself, it bursts, and then it bleeds into and around the brain, which can be very serious, can't it? And then a mini stroke is, you'll call that a transient ischemic attack, or you can call it a mini stroke, and that is pretty much caused by a temporary disruption in the blood supply to part of the brain. Now, if we go to the next slide. So now we've learned about the different types of strokes. What are some of the signs and symptoms of both a right-handed sided CVA and a left-sided CVA as well? So some of the signs and symptoms are that you will have muscle weakness on either side of the body. So when you see people who are not able to lift certain things up, or they're not able to, you know, like, okay. Well, that's interesting. They disappeared. Okay, cool. So that's wonderful. Yeah, okay, cool. So, yeah, so like I was saying, muscle weakness on either side of the body. Then you'll have vision problems as well, including problems seen from either side of each eye. Another sign or symptoms of someone having a stroke is when they get hearing problems. So people who can't hear properly that well, or when you're talking to them, you know, like they're not in the room, let's say. Another thing would be sensory changes on the other side of the body itself. So if people are in a particular room, they may not be able to sense things that are around them. So on their left-hand side or on their right-hand side, people may not be able to, you know, people may not be able to feel what is on either side. The next thing is that there's particular problems with their depth perception or directions itself. Now, with that, people, you know, who are having a stroke or a mini stroke, let's say, they may forget where they are, where they're going. People with a stroke, they may struggle with, you know, their way around certain places. So, you know, if they're in their home, they may forget where they are actually, and that in itself is pretty concerning, don't you think? And another thing about having problems with directions as well is that, you know, when they have a stroke, they will probably, you know, they probably won't be themselves. They probably won't have no recollection of what is happening around them either. The next thing is that people will have problems with their balance. So, you know, when they're standing up, when they're getting up and about as well, they will just have problem with balance, with staying on their feet. Another thing is that there'll be a feeling of spinning when a person is still. So even if the person is still, or they've got somebody else who in the room with them, if they are still, the other person may think that the world is spinning around them, like the room is actually spinning. Now, another thing is that people might have memory problems as well. Now, memory problems can be a very big issue for a lot of people, and especially where you know, especially where you need them to remember stuff. They may not remember what they've actually said, or what they've eaten, or what they've done as well. So we're now going to move on to the next particular section of that, the reasons to perform a neurological assessment. Now, there's so many reasons why you have to, so many reasons why you have to perform an assessment. So you may want to provide an assessment so you can identify, you know, if there's a dysfunction within the nervous system itself. You may want to perform an assessment so you could detect life-threatening situations too. Then you want to have a look at whether there's a neurological baseline, so it gives you something to work on as well. The next thing is that with that neurological baseline, you can then begin to see the likelihood of them having a stroke or the likelihood of them maybe recovering fully from a mini stroke, let's say. So it then help you to put things in place before it happens, or if they do have a stroke, it will help you to put things in place. Now, the fourth reason why you need to perform a neurological assessment is that you can compare data to previous assessments to see if, like, you know, to see if that particular happens, isn't it? To see if that thing particularly happens. 1 second, guys. I just need to do something. Okay, that's perfect. Okay, cool. So then, yeah. So then, we compare data to previous assessments, so we can determine change, trends, and necessary interventions. So, like I said, with finding out a neurological baseline itself, you are comparing that data to what you've already seen, and whether it is changed or whether it is stayed at the same level. So we're now going to look at the next one, which is determining the effects of the nervous system dysfunction on activities for daily living and independent function too. So why is that important? Why is that important? It's important so when you give the patient a neurological assessment, it will see, you know, your it will see about how it affects them on a daily basis, how it affects them and how they see things and how they are living, and how, if they've got any loved ones around them, how those loved ones are treating it as well. And the next thing, the last thing in this particular section, is that you're providing a database for which nursing interventions will be implemented. So from questions, from part 5, if we have seen, if we have seen that they've got struggle with their memory, they ain't got a lot of balance, they, you know, they tend not to feel a certain part of their body is always numb, then part 6, the nurses who are working with them will able to implement certain interventions which will help these particular, you know, the particular people with strokes moving forward. So if you have, by all means, guys, if you have any questions moving forward, feel free to put it in the chat group itself. Okay, cool. So yeah, we looked at that one before. So yeah, let's look at part 2, and now we're going to look at some of the common risk factors of a CVA. Now, a CVA, you know, when we look at an individual itself, and let's say they've had a stroke, normally before they have a stroke, or you are looking at a person's lifestyle, or you're looking at a person, you know, a person's makeup, let's say, then what you will need to do is, you know, what you will need to do is you will need to look at certain risk factors that are included with a CVA. So that would include the following: age. Now, age could be an important factor, don't you think? If, let's say, a person is that what, maybe in their 40s, 50s, 60s, then you may find out that, yeah, it might be common. It might be common. You'll find out it might be common, isn't it? You'll find out it might be common. You will find out it might be common that, you know, these people are having a stroke because of their age. However, if they are of a younger generation, so like in their 20s, their 30s, then that should give you some cause for concern. The next thing around that is around a person's medical conditions. So if a person has certain medical conditions themselves, then, you know, a person having a stroke and a medical condition, that is always a recipe for disaster, isn't it? Because the medical condition could make the stroke even worse, or vice versa. If they have a stroke, it could make the medical condition much worse as well. Now, the next thing is lifestyle factors. So you might ask me, why is that important? So let's look at it. You might have seen that, you know, people who drink alcohol, people who smoke, people who eat a lot of junk food, let's say, likely a doctor will ask them, have you been drinking alcohol? Because, like, when you drink alcohol, it has an effect on the brain, and when you drink too much alcohol, it has an effect on the brain itself. You may find that someone has a stroke based on how much alcohol they have drunk within a month period of a year, or in a day as well. So you've got to look at some of those factors and see why it is important, why, you know, why they have had that stroke. What is their lifestyle all about? What is their lifestyle doing for them? The next thing you would have to look at is the family history itself. So the family history, you know, you'll have to look at people within the family itself. So so, you know, is there people, you know, is there people in the family who've had a stroke as well, or they've got certain medical conditions that runs through the family as well? Now, why is that important? It could be important because then the family doctor may be able to get involved sooner. It's important so the people working within the family itself can intervene before the person has a stroke. It's important so when the family are looking after the person who's had a stroke, they can look out for the signs and the symptoms too. And then the next thing is ethnicity. Now you may be asking, like you might be asking me, so why is ethnicity important when a person is having a stroke? People from different backgrounds will normally have a higher chance of having a stroke than other communities itself. And then you may have other people who, you know, you may have other people So, sorry about that, guys. I've got a bit of a sore throat this evening. So ethnicity is important because, you know, certain people will come from certain backgrounds, certain countries, and they have a higher chance of having a stroke. And we know within certain cultures and certain backgrounds that certain people may have sickle cell, let's say. They may have, you know, high blood pressure, diabetes. And that all can be a factor because of their ethnicity, can't it? But we know that sickle cell in you know, in, let's say, the Black Caribbean sector, it's pretty high, isn't it? So yeah, that's quite interesting, isn't it? So that's pretty much some of the things you want to look at when it comes to risk factors itself. Now, the other thing, you know, the other thing is, you know, the other thing is about the individual themselves. So education, do they know what a stroke is? Are they literally going to understand why they need to have a good lifestyle? So it's important that you train up these people to you know, to literally, it's important that you train up these people to literally understand what a stroke is. And on that particular part of it, we're now going to look at 2.2 and what that is all about. But before I do that, does anybody have any questions so far? Do you have anything to add, or do you want me to clarify anything? If you do, put it in the chat, etc., etc. So we'll get started in another 2 to 3 minutes. Okay, cool. Perfect. All right, cool. That's perfect. That is absolutely perfect. That is perfect. Okay, cool. Wonderful stuff. All right, cool. So let's go to 2.2. But before I do that, so yeah, so just like, you know, when it comes to risk factors, age, medical conditions, family history, ethnicity as well, and yes, so that's good stuff, isn't it? That is good stuff. Now 2.2 is when you are diagnosing a stroke, there will be various ways of doing it. So, you know, a brain scan is normally the best option. However, like there's other areas to diagnose, other ways that you can diagnose, such as an ECG. So an ECG is basically where you look at the person's heart and you see how fast they are beating, etc., etc. Or you can do a scan of the brain. So they call that a brainwave pattern. So when you look at the brain, you'll see like the brain waves and stuff like that as well. So if we now move to the next page, we'll see what we are doing as well. So what we see here is that, so what we see is that strokes are normally diagnosed by doing physical tests. And also, it is also diagnosed by studying images of the brain that is produced by a scan. Now, if it's important to notice that even if there are physical symptoms, they need to know what has caused the actual symptoms itself. Now, these tests will normally include a blood test. You're going to be checking pulse for an irregular heartbeat, and then you might want to, check for blood pressure measurement as well. Now, why is that important? Why is it important to look at the blood pressure itself? It's important to look at blood pressure because if a person's blood pressure is high, that means they will be more susceptible to an attack itself. And within that particular thing as well, we also know that if a person has high blood pressure as well, it's literally, it is literally like, what do you call it? It is literally a very big concern for when doctors, when doctors look at a person's blood pressure itself, they know how serious it is. So if it's not put under control, then that can really cause a big problem, can't it? So we know that strokes are quite serious, don't we? They are very serious, and they need to be treated very seriously too, don't they? And they're of high importance. So whenever someone's had a stroke, or there's a suspected stroke as well, they really need to be having a scan within 1 hour of going to the hospital itself. And if we said like we said on the previous slide, education is key. So if you are, if you know someone's having a stroke and you can see the signs, you can see maybe their arm dropping to the side, or maybe part of their face is dropping to the side as well, then you know that that's when you should be striking. That's when you should be acting as well. And that's like, that's when you should be striking. That's when you should be striking, isn't it? That's when you should be, really on your game and really like talking to the hospital as well, isn't it? So if we move to the next page, so part 3, and this will be the final section for today. This will be the final section. But if I just go back, so if I just go back, then, if I just go back, when we talk about strokes, and we talk about the signs of a stroke as well, sometimes it may not be as easy to spot a stroke if you don't know what it is. Now, it's easy for people to say that you got to call the ambulance if someone's having a stroke, but sometimes someone might have a stroke, but it's not as it's not as big as another, as someone who's like limp on one side. So it's important for family members, for doctors, for nurses, and people just involved in that particular section to really understand what a stroke is, the different types of strokes, and how it literally affects a person. And you know, if a person's got slurred speech, or their vision is going, like if they've got blurred vision as well, they should be some of the signs that, oh, okay, look, something's wrong here, like something's going wrong here, something's really, you know, something is really wrong here. I need to take them to the hospital itself. And the thing about it as well, don't wait until the person has a stroke. You should take them anyway, because you never know, you may get there and they will literally save the person's life, because they could do a blood test. If you've got an irregular heartbeat, that in itself, and then, you know, with the blood pressure measurement as well. So with that, we're now going to move on to the next section, and the next section is all about examining treatment and support that is available after a stroke.
So looking for these films, there are the initials. What are the films?
Well, the film that I thought might come up, so I'm going to say Eternal Sunshine of the Spotless Mind.
Eternal Sunshine of the Spotless Mind. That's the Michelle Gondry one. Let's see how many I said that.
Okay, perfect. Now, examining treatment and support available for a person who is recovering from a stroke. They've had a stroke itself, or you might call it pre and post stage. So following a CVA, well, we call that a stroke, in it, there will be specific types of care that will be available. There will be specific types of treatment as well. And that can also include long-term care and acute term care. So what is long-term care and what is acute term care? Well, long-term care is pretty much what it says on the tin, on the tin. It's pretty much what it says on the tin. So it's you know, it is long-term, isn't it? It is long-term. It is long-term care. So after the person's had a stroke and they've been into hospital as well, and the doctors have decided that they're at a stage where they could possibly go home, let's say, you will then need to start planning ahead and be thinking about, okay, so what is the outcome for in this particular situation itself? So following the CVA, you know, it's going to be different types of care, like we said. So you got long-term and acute term care. Long-term care, it involves planning around that post phase of care. And normally what you will have is various different types of professionals who have a long-term understanding of what a stroke can do on an individual themselves. So you may see a physiotherapist, you might see an occupational therapist, you may see a rehab doctor, psychologist, speech and language therapy, and a dietitian. Now there's a lot of people there. There's a lot of people in that particular section. Now we can break them down. So a physio is someone who gets people moving again. So for example, if the stroke has affected one part of their body, so their arm and maybe their leg as well, after they've come out of hospital, the physio would then be in charge of giving them activities or giving them exercises which they can do on a daily basis, which will help them with getting that side moving again. Now, an occupational therapist themselves, they don't do the same job as a physio, but they're still doing therapy in the term that, you know, they are more focused in the operational side of the person. So how will it affect them going to cook, going to the toilet, when they're going to sleep, if they're going out, or if they're just sitting down? What is the equipment that they need to, you know, what is the equipment that they need to help them function on a day-to-day basis? And now a psychologist, they are someone who will ensure that the individual who has had a stroke is on point. They are mentally ready for the goal ahead. These people are there, so like if you know, if somebody's had that particular issue itself, they, you know, they will be there to support the individual, and not only that, they are there to support the family as well. Now you might be asking, but why do we need to support? Why do we need to support the family itself? Now, that's a really good question, isn't it? And one of the things that we need to do is that after a person has had a stroke, there might be a long-lasting effect on how the family cope with it too. So the psychologist is normally involved, and just to make sure like that, the family, their family don't have, make sure that the family don't have that particular, you know, that particular feeling. And sometimes guilt may come on as well. So a person looking after the person who's had a stroke, they might feel that they can't do certain things because they have to, you know, they have to look after them. So it's really key that while the person is in hospital or they're planning the long-term phase, they literally consider all angles. Now, a person may see a speech and language therapy too. You might ask me, so what's the reason why they have to see a speech and language person? Well, you'll need to see a speech and language therapy person because of, sorry guys, I need some water. My throat's a bit sore with it.
Okay, let's reveal our 5 musicians. So that we have got A.
Okay, cool. So they may have to see a speech and language therapy too, because of the fact that after the stroke, it may have an effect on their speech. And if one side of their body is inactive for a period of time, then that would affect how they talk and how they communicate with people too. And they'll have to they'll have to teach them how they can talk and communicate without moving that side of the body or this side as well. And dietitians, why is that important? It's important because after a stroke, they may not have the full function of their body either. So that's, you know, that's pretty much what, like, the first part of it, and who would be involved. Yeah, that's pretty much like that. And you know, who would be involved in that? Who would be involved? So now we're going to look at the acute term care part of it as well. So acute term care. Okay, fantastic stuff. So acute term care. Now, after an you know, after an individual has had a stroke, doctors may decide that long-term care isn't suitable for the individual. They want to get them back into the community itself. They want to get them back into the actual community itself. And so what we're going to be looking at is fantastic stuff. That is good stuff, isn't it? That is good stuff. So acute term care. Stroke rehabilitation is what you would call acute term care. Acute term care is you go into rehab for maybe 2 to 3 weeks, let's say. Yeah, so like you may go into rehab for you know, 2 to 3 weeks in it, and in you know, in that particular place, what happens in rehab is that they will focus on goal setting around rehab. So you'll have you know, you'll have assessments, therapies, and interventions. So when you leave hospital or you leave that place, it will help you to promote, it will help promote optimal ongoing physical, cognitive, and emotional recovery for stroke survivors as well. Now, why is that important? Well, that is very important because of the fact that, you know, people have certain, you know, certain things they like to do after a stroke. People have certain things that they did and they might want to get back into as well. So the role of the rehab team is to help them make that transition back into you know, back into that particular place, in it. And so the goals of the stroke rehab is to help stroke survivors regain as much independence in functioning and increase their quality of life. Now, with that being said, the first part of it, with the long-term care, it is quite common that a person may go through acute term care, but it might be seen they need long-term care. Or people who need long-term care may not need it. They might need acute term care. So it's always good to assess the individual while they're in the actual hospital itself and begin to realize, all right, cool. So what is it do they need? When do they need it? And how do they need it? And do they have the ability to function on the outside without any medical input or any medical intervention? Now, the next part is we're going to look at in the whole the whole grand context of things, who exactly, what do they do? What is their role in helping someone get back to independence after the stroke? So the first person we mentioned, well, no, we didn't, but the first person we mentioned was a therapist. So the therapist, their aim is to re-educate movement, sensation, and balance in order to help the patient to reach their potential for full recovery of mobility and independence. Now, that's important because the physio would then need to work with the occupational therapist. Reason being is that the occupational therapist's role is to assess the individual's ability to participate in activities of daily living, such as personal care, kitchen tasks. Hold on 1 second, guys. Yeah, that's better. So kitchen tasks, and also their ability to manage in the home. And also, like, they provide therapy to support both the physical and cognitive difficulties too. Now, why is it important that both of them, like, why is it important that both of them work together? You're a therapist, you deal with the physio part of it, so getting people up and about, moving, walking, maybe to the toilet and back again, just to get their sensation back again. Now in OT, they'll be looking at the daily living activities such as personal care. So if the physio knows that the individual has a few problems around movement and balance and sensation, they can tell the OT that this person might need specific equipment or specific, specific items to help them do exactly that. Now, when we talk about personal care and the ability to manage in the home, so that's anything from getting up to open the door, making the bed, remembering to pay bills and stuff like that as well, cleaning up the house, maintaining its standard, the cleanliness, everything like that. And like personal care, so they might go to the toilet, but they can't, like, wash themselves after or something in it. And so that's really the thing of it. And like kitchen tasks as well, we're assuming that they don't have full sensation in their body itself, so they might need equipment that helps them to cook or helps them when they're eating the right food. So let's look at the last few things and then, yeah, we'll be done for today. So the next person is that a speech and language therapist. They will assess all types of communication itself, and they will advise on how best that the family can be helped. Then they will assess difficulty with swallowing and advise on the most appropriate way to keep a patient's swallow safe. So not only do they help with speaking and listening, but they help with swallowing and eating and drinking. And that is so very important when, when like the individual is wanting to talk to people, and also if the family wants to talk to the patient as well, how best can the family communicate with the individual who has had a stroke. And then when it comes to eating as well, you'll also be advised on the best way for them to eat safe and to swallow safe as well. Okay, cool. So yeah, you'll also have that as well, innit? Now, the next thing is that a dietitian has a very big role in the individual's rehabilitation process. Why is that? So an individual will explain to the, the dietitian will explain to the individual themselves how food can help post-stroke, and then, they will assess the requirements for, assess the requirements for each individual, depending on their needs. For example, if a person's got diabetes, high cholesterol, high potassium, they're allergic to certain foods, they might be lactose intolerant, they might be allergic to gluten, so they're gluten intolerant as well. This is all the things that the dietitian needs to know, so she can set a proper plan in place in it. Now, the next thing is that the dietitian will then support the team, the OT, in assessing for tube feeding where appropriate. And then they will discuss like the role of food in nutrition in secondary and primary prevention itself. And so the aim is that the food that this person eats should remain enjoyable for everybody that is concerned. It should remain enjoyable for the individual who is eating the food. So whether they are swallowing the food, whether they are having it via a tube, or it's being cut into small pieces, it needs to be enjoyable for them. Because we know if they don't eat food, they're going to get small and skinny, and then that will then impact on their health even further. And the last thing on this list is a clinical neuropsychologist. Now, a clinical neuropsychologist a clinical psychologist is someone who's more concerned with the neurological implications of having a stroke. So a clinical neuropsychologist, they will, they'll be seeing people who have problems like with thinking, their emotions, or their behavior of a stroke or another neurological condition itself. Now, it might be the case that someone's had a stroke and their thinking is different after having a stroke, or their emotions, they might lash out at people, they might become more quiet, they might become more withdrawn, they might develop mental health issues. So all of these things a neuropsychologist will deal with. Now, why is that important? It's important as well because after having a stroke, the individual who's had the stroke has to, I won't say cope with the condition because that's the wrong word. They'll have to manage that particular condition themselves. Now, we don't live in the person's head. they do, innit? So it's important that we come from a place and understand what it's like for them. So the clinical neuropsychologist may talk to the family and say, look, like, this is the current state of play. This is how they are feeling themselves. What you might want to do is A, B, C, and D, innit? And that really informs you of what you need to do moving forward. And last but not least, a clinical neuropsychologist, they will complete assessments and they'll carry out interventions or advice on rehab to help people cope better. And this then goes back to the top, the physio and the OT. So a clinical neuropsychologist may decide to talk to the physio or the OT and say, look, we've given them, you know, some instructions about how to remember stuff or how to do stuff. So the physio or the OT, they might come in and say, look, let's work together and put something in place. So it's more simple, it's more easy for them to understand itself. So at this point, we've come to the end of today's session. But one of the things I really wanted to, you know, one of the things I really wanted to bring home is the fact that when a person has a stroke, it's a long road ahead, very long. It's a very, very long road ahead. Now, I have witnessed people have a stroke. I have known people close to me that have had strokes as well. And their life has changed, literally. Their life is never ever the same. And sometimes it will change the dynamics in the family, in a person's life, and how they operate on a day-to-day basis. So it's very important that we are very empathetic to the person. Why is that important? It's important when you're communicating with them. It's important if they want time to do certain stuff. It's important, isn't it? So at this stage, does anybody have any questions around what we have discovered, etc.? But what we'll do is we will skip back to the beginning and we just literally, you know, so at the beginning, we you know, at the beginning, we said that, you know, there's 3 different types of strokes. So there's an ischemic stroke, hemorrhagic stroke, and a mini stroke. No, it's you know, it's very common that someone will have either one. But, you know, what if they could have both, or one or the other, or they might have all 3? You never ever know. So which is why you need to know some of the signs. So if you, you know, if you know that someone's got muscle weakness, if you know someone's got a problem with their vision, if you know someone's got a problem with hearing as well, if their sensory has changed, if they don't have a good balance, if they are having memory issues, this should be the signs, and you should be informed that, you know what, someone's having a stroke. Or if you are in the room with them, when you talk to them, they just they're blanked out. Part of their faces, down to one side, the arm goes limp, and the leg as well. That's when you need to call straight away. So guys, that's pretty much the end of our session today. I hope, I hope you've got some, I hope you learned something new about that today, and I hope that you can take this moving forward for your assignment. What I would say is that when doing your assignment too, don't be afraid to talk about any situations that you have had too, which can help you with that particular assignment. Because 9 times out of 10, you might have a different experience to somebody else. Somebody else, might have different symptoms than what another person had. So it is good to have the knowledgeable background, but also the practical background as well. But guys, I wish you all the best. And, I hope to speak to you sometime soon. But until then, I would